Peptic ulcer disease is a condition whereby the mucosal layer of the stomach or duodenum gets eroded. In some instances, this condition can be asymptomatic. The primary cause that you look at is going to be actually a bacterial cause, more specifically the H. pylori bacteria, which is usually the culprit in the formation of peptic ulcer disease. Individuals can also have conditions that cause them to overproduce gastric acid. There's one condition in particular. It's not an extremely common condition. Zollinger-Ellison syndrome is a condition whereby there is an increased release of a component called gastrin, which then will stimulate gastric acid secretion. Question number 1 for the discussion board post: what are some other things that increase the risk of developing peptic ulcer disease? The last thing to look at here are you could either have a duodenal versus a gastric ulcer. So the duodenal ulcer is a formation of the ulcer in the upper portion of the small intestine, versus a gastric ulcer where the ulcer actually forms in the region of the stomach. These are just some signs and symptoms of peptic ulcer disease. And again, these are just general gastrointestinal signs and symptoms that you can see with many different conditions. But obviously, if they seem to be, persistent, you'd want to look into something like this being the cause. And you have a little picture as far as kind of illustrating the formation of a peptic ulcer in the little corner of the screen here. So dull stomach ache, poor appetite, bloating, burping, nausea, vomiting. Again, general signs and symptoms that you see a lot of times with many different gastrointestinal disorders. Gastroesophageal reflux disease is a condition where the gastric contents will actually move into the esophagus. So what happens under normal conditions is that a little muscular ring called the lower esophageal sphincter will actually close. So as you're eating food and swallowing it, this little muscular ring around the lower portion of the esophagus should actually close to prevent the material from going back into the esophagus. In individuals who have GERD, this will not occur. So when you look at the signs and symptoms of gastroesophageal reflux disease, one of the more common things people will complain of is what we call heartburn. So heartburn is that just general discomfort in the middle of the chest that will occur soon after eating. Some other symptoms that people will complain about, they'll complain about dysphagia or difficulty swallowing. They'll complain on pain on swallowing. They may have issues with bad breath. They may complain of a sour taste in their mouth. They may have a dry cough. A lot of people with this condition will also complain of nocturnal symptoms. So from laying down at night, particularly if they eat close to the time they go to bed, they may get some movement of the content into the esophagus when they're lying down to sleep at night. So question number 2 for the discussion post: besides medications, so there's many medications that can be used for this, what can individuals do to reduce symptoms of gastroesophageal reflux? So with GERD, again, some possible problems that could develop as a result of it. You can see the picture just kind of illustrating that mechanism, and it's actually showing one of the possible causes of GERD is somebody that has a hiatal hernia. So you can see the picture illustrating the hiatal hernia, or the upper portion of the stomach kind of coming through the diaphragm. Many times that could predispose people to that as well. And some of the other problems that can contribute to the development of GERD and some things that could happen as a result are listed here. And again, just some other general causes of GERD. So there's specific foods that can aggravate the symptoms, body positions. We'd mentioned the nocturnal symptoms, obviously lying down, particularly very soon after eating, and certain drugs, certain medications can also aggravate the symptoms associated with GERD. The first type of medication I'm going to discuss in treating gastrointestinal disorders are your H2 antagonists. So H2 receptor antagonists will decrease the gastric acidity by not allowing histamine to be released from the parietal cells. So what histamine does is, when the histamine and its relationship to the gastrointestinal tract, we talked about the histamine and how that operates as far as allergies, but histamine also assists with the production of gastric acid. So by decreasing the ability of it to work in that fashion will help to bring down the overall gastric contents of the stomach. Some of the different drugs we have listed up here, and many of these are available over the counter. You have your Tagamet, your Zantac, Axid, and Pepcid. I believe the only one that is not available over the counter is Axid. Tagamet, Zantac, and Pepcid are all available over the counter. Now, when some of these drugs are available over the counter, they're not at the same dosage that a person can get through prescription. All of these drugs can be utilized to treat both gastroesophageal reflux and peptic ulcer disease. These are some of the adverse effects of the H2 antagonists. So the diarrhea, constipation, headache, stomach cramps, dizziness, rash, renal failure, or liver damage are some of the adverse effects commonly associated with these types of drugs. Proton pump inhibitors are another class of drug utilized to treat some of your different gastrointestinal disorders. They too help to decrease the amount of gastric acid in the stomach. However, they do so by a different mechanism. So if you look at the picture on the screen, so we talked about, on the last slide, we talked about the H2 receptor antagonist. So you see on the bottom, you do have your histamine receptor on there. So that's where the H2 receptor antagonist will work by decreasing the histamine receptor action. Proton pump inhibitors work at a different level. So what they do is they basically will block the final step of acid production at the parietal cell. So you see where the mechanism of action here is on the picture. So they will block that final step in the production of the gastric acid. On the screen again, you have some of your more common types of proton pump inhibitors. Your Prilosec, Prevacid, Acifex, Nexium, and Protonix are some of your proton pump inhibitors, so be able to recognize them. Table 8.1 in your textbook will illustrate some of these different drugs. Again, they will both be used to treat gastroesophageal reflux and peptic ulcer disease. Most of these, again, have now been made available over the counter. Again, the difference is if a drug is available over the counter and by prescription, the prescription strength, physicians will be able to prescribe a higher dosage than what you can get over the counter is one of the main difference. Some of the different types, Nexium has just been released over the counter. Prevacid and Prilosec are also available over the counter. Your Protonix and Acifex are still by prescription only. Antacids are a very commonly used medication in individuals that have gastrointestinal issues. The main thing that they work to do is basically neutralize the acid found in the stomach. What they do is they actually increase the stomach's pH to make it more alkaline versus making it versus lowering it, which would make it more acidic. So they have a pretty rapid onset of action. However, they also have a short duration of action. Several different forms and types. They come in both tablet and liquid form. Tums and Rolaids are some of your more commonly used antacids. So again, these will typically, a lot of times, in people that have gastroesophageal reflux and other disorders, they're usually used in combination with your other types of drugs. So they can't really reduce the amount of acid produced per se. So if someone will need to have to reduce the actual amount of acid in their stomach, antacids won't do this, but many times these can also be used as an adjunct to the acid reducing drugs that we talked about earlier, the proton pump inhibitors and the H2 receptor antagonists. A very common over-the-counter agent utilized to treat various gastrointestinal disorders are your bismuth compounds. Your most common brand name is your Pepto-Bismol. Bismuth subsalicate is the generic name you'll see. And these basically contain various amounts of salicate, so you have to be careful for individuals who are either taking aspirin or have allergies to aspirin. You have to be aware of that. Your third discussion post question I want you to look at are what are the proposed mechanisms of action of your bismuth compounds as far as how they work. Again, these are used to treat various types of gastrointestinal disorders, but again, we want to look at what would be the proposed mechanism of action. Again, the biggest thing you have to be aware of with these is your aspirin toxicity, particularly for individuals who are taking some form of aspirin for other types of medical conditions. Sucralfate, the brand name for this drug is Carafate. This is a drug used particularly for ulcers, more particularly commonly used to treat duodenal ulcers. What this drug does, it actually helps when you take it, it forms a protective barrier over the mucosal lining of the stomach. So it is a prescription-only agent. This is not available over the counter, but it maintains a barrier of protection for upwards to 6 hours. So for short-term treatment of duodenal ulcers, it is very effective. It's typically very well tolerated as well. So while that area is trying to be allowed to heal, it will help protect it in the area of the ulcer. The most common adverse effect of this medication is constipation. So that's generally the most common adverse effect, but like I said, with most patients, this is very well tolerated. Antibiotics are utilized as well in the treatment of ulcers, particularly those caused by bacteria. So we had noted that the H. pylori bacteria is a very common cause of ulcers, and antibiotic drug therapy is usually looked at pretty successfully in the treatment of ulcers due to the fact that they are very much commonly caused by bacteria. So your fourth discussion post question I want you to answer: what are the common types of antibiotics utilized in the treatment of ulcers? As far as adverse effects of the antibiotics most commonly utilized, your GI symptoms of diarrhea and nausea are very common. Again, with antibiotics, the diarrhea is typically going to be caused by the destruction of the good bacteria in the stomach, so it'll kind of throw off the normal flora of the gastrointestinal tract. There are also other antibiotics, abnormal taste in the mouth and headache are commonly associated with them. So those are your adverse effects. Again, in the discussion post, note what are the common types of antibiotics utilized in treating ulcers. So another condition of the GI tract, looking at diarrhea, so the abnormal frequency and liquidity of fecal discharge, a lot of different causes of diarrhea. So diarrhea usually is going to have some type of secondary cause to it. So kind of the trick is discovering why does a person have diarrhea. So various causes. You can have infectious causes, and that could be caused by both bacteria and viruses. Parasites can also cause diarrhea. You can have toxic causes of diarrhea, drug-induced. As we talked about before, there are some medications that will cause diarrhea, and diet can also do this as well. So part of what is you have to figure out is what is going to be the actual cause of the diarrhea. So in kind of looking at what's causing the diarrhea, because that will sort of help dictate how you want to go around suggesting as far as treatment and whether someone's going to go for referral or not. You have your acute and chronic causes of diarrhea. So most acute diarrhea is going to be due to some type of either infectious, toxic, drug-induced, or dietary origin. Usually what you will see with acute diarrhea is either some type of bacterial cause or viral cause. You also have traveler's diarrhea, which is caused by, again, ingestion of food or water contaminated with bacteria or parasites. Usually when people travel to areas where the hygiene and sanitation isn't quite the same, they can develop this. So it's a good idea, for instance, when people travel to other areas that don't have good sanitation practices, not to drink tap water. Your book also talks about unpasteurized dairy products, probably not safe in certain areas, certain parts of the world. Your chronic diarrhea, you're looking at 2 weeks or longer. There you're either looking at an organic cause of diarrhea, for instance, things like low hemoglobin concentration, low serum albumin are some of the different causes, versus more functional causes, which could be caused by stress-related, things like irritable bowel syndrome or inflammatory bowel disease are some of the functional causes of diarrhea. So as far as treatment for diarrhea, I want you to kind of make note of figure 8.1 on page 111 in your textbook. Kind of goes through a flow chart. The biggest thing you have to be concerned about, and this is particularly true for athletes, but really in the end for everyone it's important, is you have to control the loss of fluids. Remember, the body is going to be expelling large amounts of fluids through the watery bowel movement. So that's going to be the biggest thing you have to be concerned about. Again, many times diarrhea is very treatable. It's relatively benign. Obviously, if it goes on for longer periods of time, you need to refer, and there's some other kind of red flags in there that you can see with this. As far as medications used to treat, you're going to be using your antiperistaltic agents. We kind of talked a little bit about the mechanism before. Another discussion post, so lots of discussion post questions to keep you guys into this. What is the common antiperistaltic agent utilized, and what are some of the common adverse effects of that particular type of medication? Another medication that is commonly used for diarrhea as well, so the antiperistaltic agents are one. Bismuths, which we talked about earlier, the Pepto-Bismol, is another type particularly used to treat acute diarrhea and just general stomach upsets. So you can use the Bismuth. What they do is they usually recommend 30 milliliters or 2 chewable or dissolvable tablets every 30 to 60 minutes. Up to 8 times a day could be the recommended treatment if you decide to utilize the bismuth compounds to treat the diarrhea. So kind of looking at the other end of the spectrum, so we talked about diarrhea, increased frequency, watery bowel movements. Now we look at constipation. So constipation is a decrease in the frequency of fecal elimination. And people who have more chronic constipation, you look at fewer than 3 bowel movements in a week. Many different causes of this, lifestyle causes, certain health conditions, medications could cause diarrhea. And certainly there's psychological and stress components related to diarrhea or to constipation as well. Many times when you look at lifestyle, you look at diet. Typically diets low in fiber can contribute to constipation. Insufficient fluid intake. Basically what's going to be happening is people who are constipated have very dry, hard stool that is difficult to pass through. So, inadequate fluid intake. You look at lack of exercise. People who exercise more will have more consistent bowel movements because it will help with the bowel motility. And then there's some other things that your book probably talks about. There's certain medications that are used to treat certain conditions that will cause this. Just certain health conditions in general. Again, your book mentions some of these: multiple sclerosis, Parkinson's. People with different types of inflammatory bowel diseases can have this as well. So take a look at some of that in your book. It's not per se a discussion question, but some of the other reasons why constipation can occur. Now, treatment-wise, there's different types of treatments, and again, what I'm looking from you is to be able to, again, look at the different categories of treatments, how they work, and what type of medications are included. So you have what are called your bulk-forming laxatives, things like Fibercon and Metamucil. So they will add bulk to the stool, allow for easier transit through the colon. Your stool softeners, and a common example of that is Colace. And what the stool softeners do is they pull moisture into the feces. So it's really important that, if you're taking a stool softener to help treat the constipation, that you take in adequate amounts of fluid. And usually the medications, and these are available over the counter, will tell you that you have to do that. Stimulant laxatives, Adulcolax, what they do is they increase peristalsis, and what they'll do is they'll kind of stimulate the smooth muscle of the gastrointestinal tract, which will help kind of activate that bowel motility and increase your bowel movements for that. And then saline salt laxatives, you have your Phillips milk of magnesia and your Fleet enemas. They could be utilized as short-term treatments. Again, take a look at Table 8.3 in your book. It kind of summarizes these and kind of gives you some other names of medications in each one of the categories. So it's important to understand the individual categories, the type of medications, how they work. And some of it, in as far as what you choose, it may depend on the person. Some people might not like to take the stimulant laxatives because it might almost be too aggressive for them. Some people may prefer just a basic stool softener to kind of help with the process. Another condition treated with different gastrointestinal medications is the development of intestinal gas. There's 3 different ways in which people get increased amount of gas and the discomfort it causes. One way is simply just through swallowing air as you're eating, can build up gas. There's the intraluminal gas, which can be produced by different types of foods that you eat, and the formation of different gases through bacteria. They're all different types of things that could increase the gas, and then I have some of those causes listed here. And then just the diffusion of gases through the blood flow. Again, different types of gases could be extracted, and again, this could kind of interact with the bacteria as well that's naturally in the gastrointestinal tract. So all of these different things can potentially cause the increased formation of gas, which can produce discomfort in the stomach. You notice up here the oligo and the polysaccharides, the lactose, so people who are lactose intolerant, they don't have the ability to break down the lactose as well, so that could again produce that gas. And some people also have trouble, breaking down the more complex polysaccharides in their stomach, so that could certainly could cause issues. So next we're going to talk a little bit about some of the different types of treatments that we can utilize for this. So your treatment for gas, two options discussed. One is what the brand names known as Gas X, or Phazyme's another one. The generic name is simethicone, and what these medications are is they're defoaming agents. So what they basically do is reduce the surface tension of the gas bubbles and allows them to break down, and the way then the gas ends up getting released is through either belching or flatulence to help relieve the pressure from the gas. The other treatment utilized, and it's primarily a prevention mechanism, is through alpha galactosidase, and the brand name of that is Beano. And what Beano does is helps to break down the oligosaccharides, so it helps to break that down and allows it to be metabolized a lot more. And that would be in people who, again, have difficulty with digesting and kind of breaking down those substances. Again, that's what you're going to see a lot in, like, beans, peas, grains will cause that, and in people who just don't have the ability to break that down as well. Again, it's going to be primarily a prevention-based thing, so it needs to be taken. That actually needs to be taken before you eat the Beano. Otherwise, it's not going to be quite as effective. The antiemetics, now this is not in your text, so be mindful of that as we're going through that. So if you've read the text and you're wondering, I don't remember reading anything about antiemetics, it's not in your text, but I want you to know and understand the different types of antiemetics and what they're used for. So antiemetics are used in the treatment of nausea and vomiting, so they're used to prevent that. So individuals who maybe get motion sickness might take an antiemetic to prevent them from getting nauseous and throwing up. So again, different mechanisms of action. You have your dopamine receptor antagonist. So they act on the dopamine receptors in the brain, and they will have anticholinergic and antihistamine effects to work as far as the mechanism to preventing nausea and vomiting. You have your 5-HT receptor antagonists. These relate more, they have CNS and PNS actions, so they work on the central nervous system and the peripheral nervous system. They will not usually be used in instances of infection. So if somebody is sick and vomiting because of say a bacterial infection from like food poisoning, it's not the best idea to utilize this type of medication. And in a lot of instances, part of the mechanism of vomiting and being sick when you have something like a bacterial infection from a food-based infection is to help eliminate the bacteria. So you don't want to keep that in your body. Your body is utilizing the vomiting mechanism to get rid of that. And then these are your common side effects. So the dopamine receptor antagonist, remember we talked about how it has an anticholinergic mechanism. So what you get with anticholinergics, with other classes of medication, for instance, like the respiratory medications we talked about, dry mouth and sedation from those medications. And that's a lot of times with a lot of people who take dopamine receptor antagonists will talk about that it does make them very tired. And then your 5-HT receptor antagonists, headache and constipation, are probably some of your more common side effects associated with those.